Hi, I'm Dr. Matt Wiederholz here at Performance Pain and Sports Medicine in Houston, Texas, and I'm sitting here with our patient Donna. Donna has been suffering from low back pain and has arthritis in the spine. One of the treatments that we utilize here at Performance Pain and Sports Medicine is Radiofrequency Ablation. So that sounds kind of like a fancy term and sounds kind of scary because the word ablation. However, we do a nerve block first to determine how much pain relief we can expect. A nerve block is a very simple procedure done here in the office, and if we experience greater than 50, preferably 70% relief of pain, then we proceed with the ablation treatment. The ablation treatment is done in the hospital setting. Patients are typically sedated for that, so it's very comfortable. A specialized needle is placed to allow us to put a probe through the needle and deliver radiofrequency energy to the tip of that needle. And the tip of that needle then heats up and essentially burns the nerve. By causing a thermal lesion or a burn to the nerve, we can interrupt or block the transmission of the pain signals through that nerve. We target several different areas in the lower back that go to the joints of the spine, and we can alleviate pain. So Donna, tell us a little bit about the symptoms that you were having in your back before the procedure.
Okay, I had pain almost 24/7. I couldn't sit for any length of time without having to get up and move around because the pain was so bad. I had trouble sweeping, working in the garden, anything that I enjoyed, walking. And the ablation now, I feel like a new person because I feel like I have no pain at all. It is just, I couldn't sleep at night. I would get up every night between 2 and 3, walking, trying to exercise to get rid of the pain. I have slept through the night at least 2 weeks without being interrupted with pain. It's a great feeling. It's
Fantastic.
The best feeling I've ever had.
That's wonderful. Now, would you say that the process of the ablation treatment was complicated? Was it a big deal, or did you think that this was a pretty minor procedure?
It was very minor. It was one of the easiest procedures I've ever had.
And did you experience much discomfort?
No.
Excellent.
No, I didn't experience any discomfort at all. Maybe a little soreness here and there, but that was not like pain. It started going away within a week. The pain started getting better within a week after the
Excellent.
procedure.
And that's very typical. After we perform the ablation procedure, usually there's some soreness because you are using a heating technology to cause a thermal lesion. And so there's going to be some soreness. Sometimes we have to manage that with some anti-inflammatory medications, ice, or even pain medication. But usually after a week, sometimes a little longer, patients start to experience significant pain relief. Your body eventually will regrow those connections, but that process usually takes about 6 months for those connections to regrow. And so we tend to see very nice pain relief for about 6 months, and in some patients even as long as 12 months. And so the procedure is approved to be repeated up to twice per year. Medicare and other insurance carriers will allow you to repeat this procedure twice per year. And so most patients feel that once or twice a year, an ablation treatment like this really helps with their back pain. So essentially, that's the procedure in a nutshell. We're talking about radiofrequency ablation for treating back pain and arthritis of the spine. I'm Dr. Matt Wiederholz here at Performance Pain and Sports Medicine in Houston, Texas. I want to thank Donna for joining us and giving us and sharing her experience with this procedure. Thanks so much for joining us.
Thank you.